Dress, new shoes, or the tacky sweater, the best thing to wear this holiday season is a straight, bright smile. Here to explain, please welcome Dr. Karan Wade, along with her patients Bill, B, and Roxy. Hi.
Good morning. How are you doing?
All right. There are so many choices today that whatever is wrong with your teeth, it can be fixed.
Absolutely, absolutely, Deborah. You know, a lot of people think that the smile that they were born with, that they have to keep it, but that's why God made me, so I can fix the things.
Yeah, there you go. Talk about the Christmas wish list right there. All right, let's start with Bill Russell. Now, Bill, what were the issues with your teeth that you just didn't like?
Well, I had one of them was slightly colored from a box, and it's damaged the root, and she cleaned it up and colored it up and.
Cleaned it up, colored it up. Yeah, because the thing is, you can be born with like the great colored teeth, but there are all kinds of things that we do to them over the years.
Absolutely,
so
absolutely.
When it comes to whitening, lots of choices out there, but which one did you use for Bill?
We used the Zoom whitening on Bill. He had his head, as he said, he boxed and he got hit in the mouth, and so the tooth got discolored because the tooth died, so it discolored. And so we bleached the tooth, bleached all of his teeth up to the shade that he wanted, and he was very happy with a smile, and now he's just got that super smile.
Yeah, and with the Zoom.
With the Zoom whitening, what we actually do is that we actually paint the gel on your teeth, and then there's a light that actually activates the gel, and you zoom the treatment for about 30 minutes, 45 minutes, sometimes up to an hour, but most patients can't tolerate an hour treatment, so we usually do it in about 30 minutes.
Yeah, yeah. And of course, the thing with this, going into the dentist office is different than your at-home trays that you might want to use. You can match the color, get the right color.
The trays at home, you don't get, it doesn't have the strength that you would get in the office.
All right. And then, by the way, what happened to the other guy who hit your tooth?
I knocked him out.
Knocked him out, that's what I'm talking about. Okay. B, you had veneers. Now, there's all kinds of things you can do before you get to veneers, but veneers is the cat daddy. If you want those perfect teeth, you can do it with veneers.
Absolutely, absolutely. A lot of people whose teeth are broken, they're stained, miscolored, misshaped, and a lot of patients don't want to do the braces, especially a lot of the adult patients. So what we do, we put veneers on your teeth, and what we do with the veneers, we'll let you cut your teeth back a little bit, take an impression, send that to the lab, and the lab will send back your veneers, and it's just actually bonded to your teeth.
Yeah, we were taking a look at some before and afters of your teeth, B, and so every time you looked in the mirror, it bugged you.
Yes, I mean, I had a little space in the bottom here. She went in and got that closed for me. I had veneers previously. I didn't like the way they were done. Off, redid them. Got the works.
Yeah, got the works. And you know, she mentioned that she had them previously. The importance of going to somebody who is not just putting the veneers in, knowing how to do that mechanically, but aesthetically what works for someone's face.
Because a lot of times patients come into my office and they say, well, I have these veneers and I really don't like them, and they're kind of big and they're kind of bulky, and they're not aesthetically pleasing to the patient, to the patient's look. So what I do is go in and I just do the cosmetic procedures on them that's going to give them the ideal smile.
Yeah, and of course to make it look like this is what you were intended to be born with right here. Okay, you're not only a cosmetic dentist, but also neuromuscular dentistry, because there are other issues that are not necessarily aesthetic that we deal with in the mouth.
Absolutely, absolutely. There are a lot of patients who have problems with TMJ, with their jaw popping, their ears clogged up, neck pain, shoulder pain, and they think that it's just that, neck pain and shoulder pain, but in actuality, it's coming from their teeth. Because your teeth, there are muscles and nerves and everything that's all connected, and we don't realize that. You look at everything as a separate entity, but they're really, really not.
A lot of people might go to someone else, but not think about going to a dentist.
It might determine that, you know, they think that their neck is hurting and it's just a neck pain, but actually because if their jaw is unbalanced, that's going to cause them to have problems.
And Roxy, that was a problem that you had?
Yes, severe.
Yeah. So when you say severe, what kinds of problems were you having? Did you realize it was a dental issue?
I went to an ear, nose, and throat specialist because I felt bad, and I wanted to know why. And he explained that I had TMJ, and what is that? And so I looked up a TMJ doctor and went to the doctor, and he couldn't help me, so I went to another doctor, and they couldn't help me. And I was sitting and watching you one morning, the next day, as a matter of fact, and Dr. Karan Wade was on your show. And I went, where's the phone number right now? I got to call this lady. And she saw me immediately.
And now?
And now my jaw is back straight again. Wow. My teeth are lined up, and I have no pain.
Yay. We aim to please here at Great Day.
It really works.
Those are just like 3 completely different stories. You have other things that you offer, Invisalign, which is the clear braces,
The
if you
clear
will.
braces.
So
All right.
all kinds of, whatever it is that about your teeth that are bothering you, you can fix it. Dr. Wade has a special offer for Great Day viewers. From now until the end of the year, you can get 50% off of veneers and 50% off of Invisalign. Half. That's half. Half off from now to the end of the year. For more information on Dr. Karan Wade and the special offer, call 713-654-7756, 713-654-7756, or visit cosmeticdt.com, cosmeticdt.com, and start smiling.
Yeah.
Thank you. It is one of the most beloved Broadway musicals of all time, Les Miserables, but we've got a sneak peek at their 25th anniversary tour coming up next.